connect to them and understand how it's influenced their behaviors in the past and how to be more mindful going forward and having other ways to regulate and cope with emotions. So a very important part of the process. It's kind of more the therapy side of things. Relapse prevention, of course, is going to be a continuation of what was just mentioned. There is also an examination of taking a look at how people in their life trigger them to want to use. Maybe they're still hanging out with people that they shouldn't be. Maybe they're still hanging out at places they shouldn't be. So working on changing friends, changing playgrounds, and then also, again, working on emotions that are triggering them to want to use. Behavior change assessment takes a look at, what behaviors are still taking place even though they're sober now. Are they still dishonest? Maybe they're 4 months sober but still lying about which movie they saw this weekend even though they didn't need to. Maybe they're still hiding in relationships and not sharing their truth. Maybe they're overly compliant and quiet and passive, or maybe they're overreactive and aggressive versus being assertive. So those are all things we start to work on with them. Pre-discharge review is when we go back to the chemical use assessment and look at the areas of their life that were affected by drug use: school, family, health, friendships, mental health, social life, etc. And we all rate how well they've done in those areas. I rate them, they rate themselves, the family rates them, and then we have a family session where this can all be shared to determine, to certainly celebrate and consolidate the gains that have been made, but also to determine if there's anything else that needs to be addressed. And then if it's time to wrap up, then the ongoing recovery plan that the family continue on, being clear with boundaries, hopefully families participating in Al-Anon or some kind of work around codependency. Maybe the young person's participating in Al-Anon or Alcoholics Anonymous or Narcotics Anonymous, families drug testing, etc. And there's a plan that if relapse occurs, what do we do? So what is recovery? And recovery is change. Recovery is doing what's unfamiliar. It's not familiar for people with codependency to set boundaries and stick to them. It's not familiar for people with substance abuse to turn down free drugs on a Friday night. So recovery is change, and it's doing what's unfamiliar. And recovery is all of the work that we're doing with feelings assessment, relapse prevention, behavior change, etc. Being clean without recovery doesn't mean much. What it does mean is relapse. Being clean without doing recovery means that relapse will occur until we can dig deeper into building a better relationship to our emotional self, learn how to do relationships to other people, relate to ourselves at a deeper level, relate to others, be accountable and own our role in relationships, find new passions, new things that give us life, new ways of coping, and then an attitude towards personal growth. Those are just some of the things that I think are important in the recovery, to somebody's recovery. Some common questions: how long is the program? Well, it's different for everybody. It depends on how long someone's been using. Are there mental health issues? Are there significant family issues? Their level of motivation and how that changes along the course of treatment. But typically, we don't feel comfortable discharging someone with any time under 6 months of sobriety. Some people can get sober pretty early on and pull that off and do just fine. Others actually get sober and need to stick around longer for some time to do more therapy on themselves and deal with deeper issues that have been there the whole time but not addressed. What about their friends? Parents ask, should we ground them from particular friends? And my answer is that it's pretty impossible to restrict them from seeing their friends. But if you go back to the presentation on drug testing and the setting limits contract, what I think has worked better for families is to present to the child that you can hang out with whoever you're going to hang out with, but know that we're drug testing you and here's what the consequences are if you use. Now that way, if Johnny goes out and hangs out with Timmy and uses drugs and comes home and gets drug tested and is held accountable and does that once or twice, pretty soon Johnny will stop hanging out with Timmy, and that's just typically how it plays out 9 times out of 10. If parents just try to ground Johnny from hanging out with Timmy, well, they're going to hang out anyway, and you just have a power struggle going on in your guys' relationship, so they're going to hang out with him anyway. And many, many, many kids are unfortunately using drugs out there, so We don't want to just control kids with drug problems and make it be where they're never around it anymore, because it is everywhere, and they do need to develop their own capacity to avoid the certain situations that are highly risky for them, or learn refusal skills and how to leave those places if drugs come into the situation. Which drugs are not detectable? Mushrooms are not detectable. Salvia is not detectable. GHB is not detectable. Datura is not detectable, not too commonly used. Dextromethorphan is not detectable on home drug kits, but is detectable at the lab. LSD and PCP are detectable at labs, but not on the home drug kits, but those aren't very popular drugs anyway. So those are some of the drugs that aren't detectable. And alcohol is a very short detection time, maybe 6 or 8 hours. Parents' recovery, what about that? Well, certainly, more often than not, what we find is that probably 25 or 30% of the clients that we work with come from a family history of drug addiction or alcoholism, and also a long family history of codependency that maybe hasn't been talked about or understood in the family or any process of recovery. So we find that for parents to be effective, helping their kid to be most effective means that they need to address their own issues, their own addiction issues, or their own codependency issues, and have that assessed and be in a recovery process for themselves as well. And that's something you'll want to talk about with your child's counselor. Siblings at home are affected. Siblings are affected. They might act like they're not affected, but they are. And I've worked with many siblings who are resentful because they feel like when grandmother calls, they're always talking about Johnny and never asking about them. Or Johnny now goes from a D to a C in class, and confetti and balloons fall from the ceiling and there's a celebration. But meanwhile, the sibling has held a 3.8 in school, but it's not acknowledged, it's not recognized, there's no celebration. So they feel a little bit lost in the shuffle. They feel like it's hard to get recognition. And oftentimes they also have their own kind of codependency and powerlessness around addiction going on, in that they try to control their sibling and find out that they can't. They can't make their sibling stop using. And then what they do is they end up going after the parents and saying, how come you're letting him go outside? How come you're letting him hang out with these friends? So the dynamic is, I can't control my brother, so now I will try to control my parents to control my brother. And but ultimately they're stuck in powerlessness, which is the core component of codependency. So it is important that at some point they have their own process going on for support, or they're included in the addiction recovery, family recovery process as well. What do we do about alcohol in our home? Our suggestion is to get rid of it. That we're intervening in substance use, that a drug's a drug's a drug, and to get rid of alcohol in the home, to check the medicine chest and make sure there aren't any old prescriptions sitting around for painkillers or other things like that, that be taken out of the house as well. What if all this doesn't work? Well, 1 out of 10 clients that we work with, we need to refer to inpatient treatment or rehab. So if we get through the chemical use assessment process, the family session where they're sharing their truth, they've heard from you, you guys have been doing a good job at drug testing, setting limits, the home contract's implemented, and that's going. And you guys are putting everything you can into it. We're putting everything we can into it, but the person's not getting better, or maybe they're even getting worse. Then in that situation, we do need to refer to a higher level of care. And we are connected to really good inpatient treatment programs across the country, and your child's counselor can make you aware of that. All right, let's see, some reminders here. Turn in the chemical use assessment and the home contract to your child's counselor as soon as possible, or have them help you to develop that. Drug test at least weekly, sometimes twice a week, and call in the results to your child's counselor's voicemail so that they know prior to the session what the results are. Definitely check out parent support groups for yourself. Al-Anon there are Al-Anon meetings in most cities, some specific to parents, and your child's counselor can inform you more about that. And finally, for your child's counseling appointment, please give us 24 hours notice if they can't make it to the appointment, or if you can't make it to the appointment. Otherwise, you still get billed for the appointment. And I guess that's it. Definitely contact your child's counselor if you have any questions. Thanks for your time, and appreciate it. Bye-bye.